For the health fair, we decided to have 8 stations in all. The first one was data entry. What we were trying to do is collect baseline data of the population. We wanted to find out how far they were coming, where they were coming from, how long it took them to get here, and if they've had malaria in the past year, how many times in the last 5 years, if they had a mosquito net at home. And the idea for that was to use GIS technology. And GIS is Geographic Information System, and it's a way we can map out disease patterns. So we thought it would be really interesting and very helpful for the community and helpful for our work here is to find out from which village or which neighborhood has the most malaria, and just to map out patterns of disease. So that's something that we're interested in doing. So that was the first station, and then we also had hand sanitation, or just basic sanitation, the importance of washing your hands, and how do you wash your hands, and what's the best way to do that, and the importance of doing that before you eat and after you go to the bathroom. Then we also had a booth on malaria, and how do you prevent malaria, where does it come from? Some people still think that it's bad air that causes malaria. So the idea that it comes from a mosquito is a new or foreign thing to many people. So we wanted to address that issue, and how do you use a mosquito net? Because we knew we were giving the mosquito nets, but we had to make sure that they knew how to use the mosquito net and the importance of using them and sleeping under the mosquito net. Then we also had a spiritual care booth where we had the local pastor come to pray with patients and ask them if they had any concerns. So we had several people who went into that booth for prayer, and that was really nice, and they even did some singing. Then we also had a booth for physical therapy. They talked about proper lifting techniques, and many people here in this region complain of lower back pain. They work on the farms and they have a very hard manual labor. So we wanted to give them some tools on how to prevent back injury and what to do when they have achy joints and bones. And so we had the physical therapy group work on that issue. Then we also had a maternal and child health booth, and where they talked about breastfeeding and just proper nutrition for their kids as well. And that was a separate booth, even nutrition, where she talked about a balanced diet. What were some of the available resources as far as beans and the greens, vegetables, and fruits. Through here, it's very lush. There's mangoes in season and pineapples, and they have tomatoes and cucumbers, but not often do they eat them because they don't realize the importance of eating a balanced diet. And mostly they eat millet and cassava, 2 starches. So we wanted to talk to them about the proteins that are available in their community, even if they don't have the money to buy fish or meat, that there are other resources that they could use. So that was another booth, the nutrition, the maternal and child care, and we also had an HIV/AIDS booth to talk about HIV prevention, how is it spread, and what to do, how to get tested. And that's something that we're offering here at the health fair also, is HIV/AIDS testing. We had an organization that donated 2,000 kits, a value of $26,000, which is really nice, and to provide with the HIV/AIDS testing. So that's what we're providing today, and counseling. And we have several people trained in the counseling of, what if we do find people who have AIDS and they need that preliminary counseling. There was a dental booth as well, and we had the dental team they were working simultaneously along with the health fair. So in a different section, they were actually seeing patients.
We had hundreds and hundreds of patients. We had to turn many away, but we were able to triage what we could do per day, and we're taking them by numbers. They buy what's called a carnet, which is their medical chart, and it goes with them everywhere they go. So if they are seen by the dentist or they're seen by a physician, they write the diagnosis, what was done, and they take this with them. Because it is a bit of a transient population, this is their personal medical record that is with them at all times. We have a couple of students here that are working on an extraction. We've had some really challenging extractions with really, really dense bone and lots of decay. There is no dentist in this area. The closest dentist could be Yaoundé. It's an 8-hour bus ride away, so it's really not an option for these patients. So when they get dental decay and they have problems, it usually lasts until the nerve dies, or unless they get a real severe infection and end up in the hospital. We got a family here from the north, from the far north of Cameroon. She's actually here visiting her brother-in-law, who's actually her caretaker at this moment. She's lost her husband. So she's here, just wanted to have her child looked at. She had been retaining some of her baby teeth. So we just wanted to, mom had been concerned. She was having some crowding, so we extracted some baby teeth for her. That way her permanent teeth will come in a little bit a little straighter there. Now she's good to go. She's a good patient.
The attitude of the students has just been inspiring for me. I've been out here for a while and I've seen the same things over and over again, and their enthusiasm and excitement about serving people has rejuvenated me also, and has made it just a lot more fun for me to work here. Well, we've gotten a range of students. We have some first-year dental students who have seen a patient in the clinic before, maybe from a long ways away, but virtually no experience. And then we have some third-year dental students who have a lot of theoretical knowledge and some hands-on experience. And it's been really interesting to see how they go. Most of these guys are just taking care of themselves after the third day, where they're seeing patients with a minimal amount of observation, and they're taking really good care of them. The first-year dental students have really learned a lot in a short amount of time. It's really amazing, and it's fun to see their confidence levels grow and their relation with the patients grow. It's been an amazing experience for me.
This fair, it wasn't just about like, okay, we're gonna do something one day. It was more about long term, you know, we're gonna teach many people to improve quality of life, things that we know, you know, that sometimes we're studying classes, we pay a lot of money for classes to get this knowledge, and we share this knowledge with, you know, with many people.
Working together, Loma Linda University students and the staff at Batouri Adventist Hospital have empowered members of the local community. Now they hold their own health fair each December to meet the specific needs of the surrounding residents.